Hello, everyone. Welcome back to More Than Medicine, 7-day virtual series, live series. Today is the last day of this little project. I'm so glad that I got to meet and I got to talk to so many interesting people, students, doctors, and teachers. Today, I wanted to invite Pranay, Shah, and Gegi Kirtadze. Both of them are aspiring surgeons. They have plenty of experience in operation theaters in Georgia as well as the US. And I would like to bring both of them on and they're together called Plumbers, which is a surgical specialty interest group that both of them created because they're so passionate about surgery. So without further ado, Pranay Shah and Gegi Kirtadze. Hi, boys.
Hey, how you doing?
How we doing? We're good. So, just right off the bat, what is it about for you, both of you that interested you in surgery?
Pranay, you want to go? Guess not. So, for me, it would have been.
Can I hear us?
Pranay, can you hear us?
Yeah.
I don't think she can. He can hear us.
Okay. Wait, let me. Okay, you go. You go, Gegi. I'll troubleshoot this.
So, well, personally, for me, it would have been a more hands-on experience as far as medicine is concerned. So, surgery kind of allows you to, interact with your patients and do invasive procedures on them, which requires a certain amount of technique and certain amount of skill. So I would be interested in like acquiring those type of skills, such as, doing like difficult procedures like microsurgery or suturing, or, some more basic stuff as well. So it's more of a technical and a skill-based experience. At least I perceive it as such. And in terms of complexity, it's also quite different from regular medical specialties because it allows you to get some more, hands-on experience type of experience. And how I tend to see surgery.
Like I know you as a person, you love instruments. You love so basically you've been kind of used to using your hands, like skill based, like you said. So was there ever a time where you thought about anything other than surgery, or was it always surgery from the get go?
Honestly, it's for me. It was mostly because coming to the medical school, I was pretty determined to do more surgical specialties than the more medical ones. I mean, not to get me wrong, medical ones are quite interesting, but like I feel like surgery offers that kind of more tactile experience that
Right.
medical specialties don't really do. So that's really what got me into it. And also, yeah, I like to play instruments as well. So that's more of a personal thing, more of a subjective thing, but for every person it's a different one. Like some people like it for the art of making or doing a procedure, and yeah, that kind of stuff mainly.
So Pranay, we lost you there for a bit. So the same question that I asked Gegi, what is it about surgery?
I don't know. I just feel for me personally, it's a lot to do with anatomy as well. So I love anatomy, and that kind of translates into surgery for me. And also just the experience of being able to fix things with your hands, like 100% hand-on experience. Just the whole procedure, yeah, everything about it. Yeah.
So before you, both of you, before you even thought of medicine, like what did you ever think? I mean, what made you enter into medical school? And Pranay, what was it like? What is it about anatomy? Like, was it an interest you had before joining medical school, or were you just fascinated as you came in?
No, I definitely started liking anatomy after I got into med school, but I always wanted to become a surgeon. Just watching like a bunch of TV shows growing up and the whole art that surrounds surgery and how intricate it is. It was always surgery for me. And then I joined med school and then I fell in love with anatomy, and there was 100% no chance or nothing that could sway me from becoming a surgeon after that point. It was always surgery for me.
Nice. So, Gegi, so did you think about surgery before joining medical school, or straight up it was the same?
Honestly, yeah, because well, like most people who join medicine probably have at least one parent in the medical field or somewhat acquainted or associated with the medical field. So my mom's side usually did the medical stuff. And my grandfather used to be a surgeon, so I kind of looked up to him. So I wanted to continue the lineage, so to speak. And it was always fascinating for me because, like, when I was a kid growing up, I used to stumble upon like surgical instruments home like randomly.
Yeah.
Nothing too dangerous, but
Just things that mom brings home from work.
yeah, stuff like that. And I tend to like develop an interest in that, and I also like the procedures and the vast variety of procedures, not just like general surgery or my personal preference would be an ENT type of surgery. But all of those types of specialties in surgery offer a different experience and a different perspective on looking at all these types of operations.
So speaking about experiences, Pranay, you've been to the US for 2 clerkships, right? General surgery and surgical oncology. Can you hear me?
Hold on, I'm just going to try and change my location. I can't hear you guys.
I think you might need to move to a room where the internet connection is a bit better. Yeah. So, Gegi, you've had some experience in ENT as well, right? Yeah. So, could you tell us a little bit about that?
Yeah, I kind of saw ENT type of operations here, and also I saw it in US. That was a few years back, but the types of procedures they tend to do there, because like in terms of ENT, it's quite a narrow field and it's a subspecialty type of thing. And the types of procedures they do and the anatomy they encounter there would be quite different from what we generally learn in medical schools, because those type of subspecialties like ophthalmology, like ENT, or like more detailed like little subspecialties, for example, cosmetic surgery, they rarely get talked about in medical schools, and I don't really blame them because it's a narrow field.
Itself, the anatomy of head and neck anatomy itself is so intricate and so different because you can't there's not a lot of invasive procedures that you can go in and kind of look. You know a little bit about imaging, rather you use a lot of imaging in ENT, right? So could you talk a little bit about that, like how does that work?
So you're right about the anatomy, because the ENT anatomy, especially the facial region and the neck region, is quite complicated, and I still can't wrap my head around that. But most imaging that we do there is CT would be a big one, especially for sinus investigations, and also plain X-rays also work quite well. In some cases, MRIs are needed, but most of the time what you encounter on day-to-day practice would be a CT, especially if they're doing a intranasal laparoscopic sinus procedures or ear operations or stuff like that. And the anatomy you tend to encounter there, especially when you're going through the endoscope, is very different. It's than you see in the textbook. So
like and everything.
Right, exactly. So especially when you go up through the nose and encounter an ethmoid labyrinth, you kind of realize why it's called a labyrinth. Because you kind of get it. You don't really know which way is up, which way is down, and which sides you tend to go into. And the problem with that as well is it's very different throughout individuals. So anatomical discrepancies are a real thing there. So there's no one standard. But also what I tend to find there is that some of the structures we don't really mention in medical school, like, okay, the sinuses they mentioned, the septum and the meatus, but honestly, before going to the ENT department, I didn't really know what ethmoid bulla was, or what semilunar hiatus was, or stuff like that. Very jargon type of phrases, which probably ENT surgeons use, but like you don't really see them in different fields, like other than a little subspecialty.
Yeah.
Yeah.
So now I think Pranay is back on. Let's call him in. Hey.
Right.
So, Pranay, you've done a couple of the question I asked you before we lost you for a bit. You've done a surgical oncology clerkship, and you've done general surgery in Emory. So could you tell us a little bit about your experiences there and how your day was like, and just anyone who is new to surgery, and
So the general surgery clerkship that I did there was very different from the kind of clerkships that we had here. We probably spend about 5 to 7 hours in the hospital. But while I was doing my clerkship, I would spend about 12 to 15 hours in the hospital. all the procedures that we did, I was hands-on in most of them. I was allowed to scrub in all the procedures. I was allowed to suture the patients after that. And I didn't do a lot of that in Georgia, so the technical aspect of it was difficult for me, and the transition was difficult while doing that in the US. But with that being said, if your theoretical knowledge about anatomy is really good, which is what most of the attendings and the residents there want to pimp you on and ask you questions about anatomy. So if you know that part of it really well, you can easily navigate through it, and they'll help you out with the technical part of it. So I made sure that my anatomical knowledge and all the theory part of surgery was nailed, and the technical part, I was just really grateful to all the attendings and residents that helped me out there.
Right. I like that. Like, I remember when you mentioned you would have like such an exhausting day, but yet you would still go back home and find the time to read up about about the next day's your patient's pathologies, and you basically had a packed day, and one that was very daunting to like hear. So I wanted you to talk about how your day was like from the get go.
So from the get go, I would wake up at about 3 in the morning, and I would leave home by about 3:45. Reach the hospital at 4. We should take numbers for our patients who are post-op, so just everything in terms of their vitals. Depending on what surgery they did, we just focus on a few labs. Their hemoglobin levels, alkaline phosphatase, bilirubins, and just basic labs. And we would write that down for every patient. And we'd not only have to write it down, but we'd also have to trend it. So if the patient's hemoglobin is 10, the attending wants to know if it is 10 immediately after post-op, or has it been dropping down considerably every day from 15 to 12 and now 10. So that's red sign, and you want to look into that more. So we also have to trend these numbers. So we did that from 4 to 5:30. So we would have about 20 patients in the service that I was in, and so we'd trend the numbers, and then we'd print out the sheets, and then we'd do our morning rounds with the residents. So we'd see all the 20 patients again, find out see what's going on with them, and which is where we had our morning presentations. So typically I would finish the numbers by 5 and do pre-rounds before rounding with the residents. So I would just pick up 4 to 5 patients on a good day. I would pick up 4 to 5 patients and just talk to them and see what's happening. And I'd present these patients to my attending when I'm doing my rounds with them. And after the rounds, we just have like a 15-minute break. And then by 7, we in the OR again. So our week was split into 3 OR days and 2 days where we attended outpatients.
Right.
And the outpatients are the one we actually scheduled for surgeries in the upcoming weeks. So that's how it went. And 7 to 5 or 7 to 10, or depending on what surgery it is, we'd stay in the OR all day and then come out again, see what's going on with the floor patients, and then we'd head back home.
Yeah. I remember having this conversation with you where I was like, surgeons are, there's a preconceived notion that surgeons do not have as much patient contact. Although the maximum patient contact is with you guys. But what do you think about that? Like, how is a surgeon involved in patient care outside of the OR?
Definitely. I mean, you see the patient before you put them in the OR, right? So they're like your first up. And in fact, you build a better relationship as a surgeon with the patient, I believe, because even after like the procedure is done, you meet them on a regular basis. Like even in a single day, you meet them 2 to 3 times just to find out
Right.
what's going on, how's their temperature, if they have fever, if they have any difficulties breathing. So they're being, kept a tab on at least 3 to 4 days, depending on what surgery they've done. So I don't understand why they say surgeons have very less patient contact. In fact, we have the most intimate kind of patient contact. Yeah. Definitely, yeah.
So I wanted to call in Gegi for a bit. Gegi, so you've been working, you've been shadowing at in ENT surgery in Tbilisi for a long time. So can you tell us a little bit about how that experience was like, and like how did you get into it? How did you get?
So essentially, what I tend to do is like my mom essentially works in an ENT clinic, and they allowed me to shadow there, especially like night shifts or in the morning, and see different surgeons do different types of operations and their regular day-to-day schedules. So it can be pretty tough in terms of ENT, because a lot of unplanned or a lot of unwanted complications sometimes occur with patients, and you need to be on your toes. So you might have a call in the middle of the night when you're already resting and you're done with your operating days, or you're done with your work, and you need to go back to the hospital because somebody's having acute bleed or somebody's coming in with an acute bleed. It might not be even your patient on the one you operated. But in terms of stopping it, like they tend to admit acute patients, and you need to be there, or at least a shadowing doctor needs to be there, at least one. So in terms of shadowing, it can get pretty tough because you tend to have like 30 or 20 or even 40 patients who have been operated and are on post-op care. So they tend to stay there for, well, at least a day or two. And you have to keep an eye on each and every one of them. And you tend to do a round. So once when you're first arriving in the clinic, it's around 11 or 12. And then the next one and the night shift, when you're handling the patients and when you want to, you know, do a hands off to a different professional. Yeah, do a hands off to a different professional who's gonna handle them afterwards. So you have to do twice the checkup. You have to ask all the patients, how they're feeling, examine them physically, so if they have suspected bleeding or any other complication or vertigo, headache, dizziness, any type of those kind of complications or any symptoms if they have that, and you should manage them accordingly. So yeah.
I would assume, I mean, just correct me if I'm wrong. You since it's ENT, you'd see a lot of trauma as well, right? So you would basically be working with a multidisciplinary team, whether it's like a neurologist or like different kinds of people, even if a pulmonologist or any kind of. So what are the main specialties have you particularly interacted with?
All right. So in terms of diversity, yeah, you have. It's called ENT, but it's actually a multitude of organs. Like the throat are kind of very different and require different approaches. So what surgeons tend to do, they tend to specialize in one and then like pick up the other ones as well as they go along. But obviously that takes time. So in terms of surgical operations that I was mostly interested was the nose would be a big one, and also the ear. Ear is also quite a difficult and a very micro surgery type of operation because honestly, especially to give one example would be an autosclerosis operation or stapediectomy or stapediotomy, which is handling the stapedius, which is the smallest bone in the human body, in a very narrow tube. So that is kind of tricky and technically very challenging to do. But the upsides of it is it's gonna if a patient is selected properly and he does all the procedures necessary, you're ultimately gonna recover the patient's hearing. So the patient's gonna be able to hear again. So it has amazing results, honestly. And I was lucky enough to see most of those operations and help out on some of the operations there as well. And those ones would be like some of my interest in terms of ear surgery. Yeah, and also the other one would be cochlear implantation, maybe.
Cochlear implantation. Yeah. Okay. So, Pranay, just like I asked Gegi, what field of surgery fascinates you the most, or the one that you've had the most chance to kind of be in? In terms of procedures.
I think surgical oncology for me, because I've seen a lot of oncological procedures when it comes to surgery, especially because of the rotation I did in Emory and also one in Miami, which is also surgical oncology. Surgical oncology is really fun because you got to decide boundaries that you're going to cut around the tumor, and even while the procedure is going on, you send samples to the lab and find out if your margins are correct, or you need to take out more tissue and things like that. It's just very interesting, apart from like the part of it as well, because you got to make on the spot decisions in terms of if you want to sample more tissue or if your margins are perfect and things like that. Also, the anatomy is very interesting for me when it comes to the peritoneal organs. So yeah,
marginal resection is like super important because that definitely determines survival and stuff like that. So you guys, it's like one very you got to be really intricate about it as well, right? So a lot of surgery. I really like the fact that you guys are super passionate about surgery, which is why I kind of wanted both of you on here today. So tell us a little bit about how Plumbers came into being.
Well,
explain that name, please.
Well, it's just Plumbers. We fix things essentially. So I say we, but eventually it's going to be we. I don't know. I guess like when me and Gegi were doing like our surgical rotations, it was just the two of us who were like actually interested in surgery, and there were so many unanswered questions for us when it came to like anatomy, anatomy that translates from textbooks to actual gross anatomy when we were looking at procedures. We would just look at each other and say, is that a muscle? What tissue is that? I have no idea what's going on. What layer is that? Is it the anterior sheet, the posterior sheet? What's going on, right? It would just help if somebody was there at that point who could, show us, okay, this is how it looks in the textbook. Well, this is how it's going to look, in the OR. And I felt like we were missing that. And also the whole part where we didn't know like the names of instruments in English and things like that. And, just a bit of suture skills here and there. So, people who are interested in surgery, a lot of times they get swayed because it's really difficult to get into. And there are a lot of other topics that, it's not covered really well when it comes to that. So just a little bit on that. Yeah, did you want to add something?
I think you covered most of it. I think we had like this idea of making a surgery group or a discussion group for a while now.
Yeah.
Like even like from first year, like when we actually liked anatomy and kind of bonded over surgical procedures.
Yeah.
And I think not a lot of people in the course back then really wanted to be like a hardcore surgeon or something like that.
Yeah.
So yeah, I think it was most certainly a good idea. I mean, so far so good. Right?
From attending some of your, if anyone listening, you guys are going to have just the last few sessions before you graduate. So if anyone is interested in anatomy, surgery, and just kind of looking to expand their ideas about what kind of field they want to get into, I would highly suggest going to one of these guys' lectures. They're really funny, very interesting. They put in a lot of effort to all of their presentations, and they really truly break down anatomy to the basics from like you said, from looking at it from an atlas perspective, and then be like, oh, how does this translate into looking into a body, And I think that is amazing that you guys have finally got together and done this. Would you have any what do you think, in your opinion, both of you, I would like to ask this question, qualities that would make you a good surgeon or a doctor, qualities that you think you want to kind of perfect personally even?
Qualities that would make a good surgeon?
Yeah.
I don't know. I just think you gotta be diligent.
Some of the surgeons you've worked with.
You just gotta love what you're doing. I mean, it's just one basic thing. You just gotta love what you're doing. It's the same formula for everything.
I would add persistence, discipline, and effort.
But that's what I'm saying. That just qualifies for all kind of fields, right?
Yeah, pretty much. But like in surgery, you have to have that level of patience because you're doing overtime. Like medical school, it kind of finishes in like 6 years. Surgery, you have to do in some cases another 6 year. Depends.
It's a long road.
Yeah.
Mariam Mami Sashwili says your lectures are super interesting.
Oh, well, thank you.
Means a lot.
Yeah, so
if you guys like anatomy and surgery, you should join our surgery club.
Yes.
We met Plumbers. I think Leica will send everybody an email again, I guess.
You guys will do that. You guys do your own thing. So what do you guys do to de-stress? I know what Pranay does. I know what Gegi does to de-stress. But for people listening, what do you guys like enjoying?
Well, off late, I've been learning to play music from Gegi, so that's me.
Yeah,
and single instrument Mr. Gegi Kirtadze cannot play. So just top of your head, let's list out a few, shall we?
Sorry, what? I didn't hear the question.
Instruments.
Oh my lord. The main one would probably be guitar, and I also do a bit of piano. But in terms of interests of instruments, I tend to go more strings, like the violin, but I don't tend to play it that much. I tend to, maybe write music on it or stuff like that. But like that's besides the scope. But
recently, he's been trying to play the tambourine as well. So
yeah, that also happened.
Just one more thing that I'd like to add, when you're talking about what would make you a good surgeon. So you should also like taking risks if you're a surgeon, because a lot of procedures, like when you're doing, it's just your gut, and you gotta make taking risks second nature, I guess. Yeah.
That is
calculated ones, though. Calculated ones.
Calculated ones, yes. Definitely. So thank you so much, Pranay and Gegi. It was honestly great talking to you guys. Thank you for the effort you take to promote surgery. The passion you guys have for surgery is commendable. And thank you for sharing that with so many of our students in USMD. And with that, I'd like to wrap up our little conversation. Thanks again for being here.
Thank you for having us. Like,
Thanks for having us.
it was fun. We enjoyed it a lot.
So that is it, everybody. Thank you so much for joining in on Such a Sunday with Med Plumbers and earlier with Dr. Thea and Dr. Lika. That brings us to the end of More Than Medicine. We've had so many amazing people. We've had so many great comments from you guys saying that you liked it. And I am so grateful that hopefully some of anyone got a little bit of inspiration from any field of medicine. And also the fact that you are not alone on this journey. All the doctors who have been here have gone through the same struggles that you have. A lot of the students go through the same things that you do. And we do question what field you want to get into multiple times. It's not a decision that comes in, that happens immediately and overnight. And it's okay. Take your own sweet time. You'll figure it out. Just be curious and inquisitive. Ask questions always. And thank you again. My name is Lekha Karthikeyan, and goodbye.